Hi everyone, I am Prof.Manavalam working in SNS College of Nursing. In this video, we are going to see about the one type of non-invasive technique that applied during the time of pregnancy as well as labor in order to monitor the fetal heart rate as well as uterine contraction. So for this purpose, we are using the cardiotocography machine. In this, the first part of video, in this we are going to discuss about overview of the cardiotocography, how this cardiotocography machine works, and the parameters measured by using this cardiotocography machine. At the same time, the major parameters, that is uterine contraction, how it will be measured by using the cardiotocography in detail. Let us move on to the topic. The general introduction about the cardiotocography. It is a key tool that is used during the time of pregnancy as well as during the time of labor. In pregnancy, it is commonly used during the time of third trimester in order to monitor the fetal well-being. At the same time, we can use this machine in order to detect the fetal distress in early and prevent the complication and save the life of the fetus. And also during the time of pregnancy, it is not only monitoring the fetal heart rate. At the same time, we can use this machine to monitor the uterine contraction. So sometimes the pregnant mother, they may experience the premature uterine contraction during the time of pregnancy. And also in CTG, we will get the normal reading as well as abnormal reading. If abnormal reading the particular mother received means it indicates they need further investigation to undergo, and also immediate intervention as a midwife they have to start in order to save the life of baby especially the fetus. This is the cardiotocography. So cardiotocography, the machine, it has the two transducer. One transducer used to monitor the uterine contraction. Second transducer used to monitor the fetal heart rate. So the readings, it's come as a graphical strip from this machine. First, we have to make the mother, for doing this procedure, we have to make the mother, certain preliminary steps we have to follow. We have to make the mother to lie down in a comfortable position, and at the same time, first we have to palpate the abdomen and we have to find the uterine fundus abdominally. So where we are finding the fundus, there we have to place the one transducer. This transducer is mainly measuring the uterine contraction. So this transducer secured by the straps. Second transducer, we have to palpate the fetal part. In the fetal part, mainly we can hear the fetal heart rate through the spine. So we have to find out the fetal spine, where it is located. There we have to place the second transducer in order to monitor the fetal heart rate. This transducer also secured by the straps. So after securing the transducer, we have to start to put the start button. So automatically it start to recording the uterine contraction as well as fetal heart rate. Then we will get the readings through the graph sheet. So how we can read the cardiotocography? So the graph sheet I said, so there is a different parameters, it's mentioned in the graphical sheet. So what are those parameters that is mentioned in this cardiotocography? We can see by this acronym, that is commonly used is Dr. C. Bravido. Here the doctor DR, it is explaining about it is describing about defining the risk factors of the fetus. C, it is explaining about the contraction. BRA, it is expansion of baseline fetal heart rate. V, it is indicating the baseline variability of the fetal heart rate. A indicate acceleration of fetal heart rate, D indicate deceleration of fetal heart rate, O indicating the overall impression of the cardiotocography reading. In this slide, we will going to see about the contraction, the first parameters that is detected by using the cardiotocography. So contraction, normally they are measuring in 10 minutes window period. How they are take count of 10 minutes window period means, so the vertical line in this graph sheet, they have given two vertical line in between the horizontal line. In that vertical line, they have given the readings. So the above and below two graph line are there. The above graph line, the first graph line, and the readings has given like 60, 80, 100, 120. It is indicating the fetal heart rate. The below that, it is a toco. It is the name has given as a toco. Toco means it is indicating the contraction. It is meaning of contraction. So here the intrauterine pressure they have given as a reading of 20, 40, 60, 80, 100. So this is the two vertical line. In between these two vertical line, there are 10 lines are there. 10 lines or 10 boxes are there. So each individual box is equal to 1 minute period of time. So totally 10 boxes are there. So it is as a conclusion, it is considered as a 10 minutes window period. So in that, the below toco line, in this 10 minutes period of time, there is a two elevation we are seeing in this. This two elevation is indicating that uterine contraction. So the intrauterine pressure, it started 20 mm of Hg, it is increased into 40 mm of Hg during the uterine contraction. So two contraction that is present in 10 minutes period of time according to this graph sheet. While the time of contraction, automatically there is a variation of baseline fetal heart rate. According to this graph, the baseline fetal heart rate is 120 beats per minute. The normal is 110 to 160 beats per minute. According to this graph, it is 120 beats per minute. During the time of uterine contraction, there is a changes in the baseline fetal heart rate. It is increased up to 145. So it is clearly shown in this graph sheet. So according to the contraction, there may be a variation in the fetal heart rate also present. Based upon this cardiotocography readings, we can see about the duration of each contraction and the intensity of the contraction also we can monitor by using the cardiotocography machine. So that's all about the introductory chapter. Thank you all.